Good morning, everyone. My name is Henrik Olson. I'm a PGY1 resident at University of Minnesota Medical Center, working with Drs. Nick Goeden, Manda Johnson, and Andrea Elliott. And today we'll be looking at the modified 4T score validation for HIT in VA-ECMO patients post-ECPR. So our study aims to fill a critical gap in the literature where the standard 4T score's applicability in this specific patient group remains under-researched. And we're exploring an innovative approach that could revolutionize how we assess HIT risk in these high-risk patients. Of note, I'm going to be submitting this presentation as research to application. So today we delve into the complexities of heparin-induced thrombocytopenia, or HIT, a serious adverse reaction to heparin, known for leading to severe complications like thrombotic events and even death. Our focus here is on the 4T score, a widely used clinical prediction tool for diagnosing HIT. Its effectiveness and applicability remain uncertain, particularly in specific patient subgroups. So one of these subgroups is our veno-arterial extracorporeal membrane oxygenation, or VA-ECMO patients, following extracorporeal cardiopulmonary resuscitation, or ECPR. So these patients are at a heightened risk for developing HIT, and it's a concern that's compounded by the limited research on the effectiveness of the 4T score in this particular patient population. So this gap in research is not just an academic issue. It can lead to significant delays in the diagnosis and treatment of HIT to these patients, and it can result in serious, even life-threatening consequences. So our aim is to address this gap, understand the challenges in diagnosis and management, and ultimately improve patient outcomes in this high-risk group. Heparin-induced thrombocytopenia, or HIT, is a severe complication, particularly in VA-ECMO treatments, post-extracorporeal cardiopulmonary resuscitation. Patients on VA-ECMO are especially vulnerable due to their complex medical conditions and the invasive nature of treatment. The current 4T score, although it's widely adopted, has a lot of limitations in assessing HIT risk in these patients. So because of this, there's a pressing need for a modified tool tailored to this subgroup, potentially leading to more accurate diagnoses and better patient outcomes. So looking at a review of existing literature, we found that relevant studies like those by Choi J.H. et al. And Pong et al. Showed that patients who developed HIT who were on VA-ECMO were more likely to experience severe thrombocytopenia and arterial thromboembolism. Looking at Vitan-Prast R et al. Study further supported the 4T score system as a reliable tool for diagnosing HIT in critically ill patients. However, these studies don't specifically focus on VA-ECMO post-ECPR patients. Additionally, studies by Powell et al. And Amelie Renaud et al. Suggested that a modified ICU 4TS score could be more accurate in predicting HIT in critically ill patients. However, there's been contrasting conclusions which indicate the need for further research, particularly in the VA-ECMO patients post-ECPR, which is what our study is assessing. So on this slide, on the left, I have the modified 4T score, and on the right, I have the standard 4T score. So you can note some of the differences within these tools as far as some of the parameters that we're measuring. And down here at the very bottom, I have the sensitivity and specificity listed for each of these tools. As you can see, one of our papers actually showed that there was a higher sensitivity and specificity for this modified 4T score, which is the primary scoring tool that we'll be comparing in our study. So the specific aims of our research is to look and assess HIT prevalence in VA-ECMO patients. And understanding the frequency of HIT in these patients is crucial for developing effective treatment protocols. Next, we want to evaluate the pretest probability of the modified 4T score compared to the standard 4T score. And this involves a detailed analysis of both of the score's specificity and sensitivity in predicting HIT in these VA-ECMO patients post-ECPR. And by doing so, we can determine which scoring system is more effective in this specific clinical setting. Furthermore, we seek to identify any possible modifications or additional factors that can enhance the predictive value of the 4T score. So this could involve analyzing various patient characteristics or clinical factors that might influence the score's accuracy. Lastly, based on our study findings, we aim to develop a modified risk assessment tool for HIT. This tool would be tailored to the unique needs of the VA-ECMO patients post-ECPR and potentially provide a more accurate and efficient way of assessing HIT risk. So through all these specific aims, our study strives to contribute significantly to the field of clinical care for these high-risk patients. Some of our methods. So our study will be looking at 500 VA-ECMO patients post-ECPR. It's a retrospective study, and the patients that we'll be looking at were admitted to the emergency department or intensive care unit at the University of Minnesota Medical Center, and we'll study a significant period of time from January 1st, 2017, all the way to October 16th, 2023, which is when we submitted our IRB proposal. So the data collection includes baseline characteristics of these patients. We'll get demographic details, medical history, specific conditions, and we're particularly interested in outcome variables like the incidence of HIT, the effectiveness of the 4T and modified 4T scores, and their specificity and sensitivity. We're also gathering data on additional clinical variables and biomarkers that could potentially enhance the predictive accuracy of these scores. For data analysis, we'll start with descriptive statistics to summarize the characteristics of our study population. So we'll be calculating means, medians, standard deviations, frequencies, and percentages. And we'll also use a bivariate analysis to examine the distribution of these variables in relation to HIT incidence. We'll also conduct a multivariate analysis, particularly logistic regression models, to calculate the prevalence of HIT in relation to our specific aims 1 and 3. So this will provide us some deeper insights into the relationships and potential causal links between various factors in HIT incidence. Additionally, the specificity and sensitivity of the 4T and modified 4T scores will be calculated and analyzed to address specific aim 2. So this will help us determine the effectiveness of these scores in predicting HIT. And lastly, an important aspect of our study is the cost analysis. So here we aim to identify potential cost savings that could arise from using a more precise modified 4T score. This analysis is critical as it could inform our healthcare policy and resource allocation decisions. And listed here, I just have our inclusion and exclusion criteria for those who will be included in our retrospective study. So we anticipate that our study will result in a more effective HIT risk assessment tool for VA-ECMO patients post-ECPR, and this can lead to improved clinical decision-making. So hopefully an enhanced HIT assessment, clinical practice benefits, and future research directions will all be impacted. Here are my references. Thank you.